Do you wake up in the morning and before you even look at the clock, before you sit up, before you think about coffee, you notice one thing right away? Your mouth feels dry. Not just slightly dry, I mean so dry it feels like your tongue is sticking to the roof of your mouth. Like there is almost nothing there to swallow. Like your mouth worked all night and ran out of protection before you even opened your eyes. If that sounds familiar, I want you to listen carefully. Because many people are told this is just part of getting older. They are told it is no big deal. They are told to drink a little more water and move on. But in many cases, chronic dry mouth is not just a small annoyance. It can be a signal that something deeper is going on. My name is Dr. Michael Carter, and over the years, one thing I have seen again and again is that adults over 50 often ignore the earliest warning signs, especially when those signs seem small, quiet, and easy to brush aside. Dry mouth is one of those signs. Not because it is always dangerous by itself, but because it is often connected to the exact kinds of health problems people want to catch early. Problems with sleep, problems with medications, problems with blood sugar, problems with immune function, problems with nutrition, and in some cases, problems with the lungs and heart. That is why today I want to walk you through this carefully. I am going to show you 7 warning signals that dry mouth may be hiding. I will explain why this symptom matters more after 60. And I will give you a practical, step-by-step plan you can start using today. But before I get to the 7 warning signs, I want to tell you about Margaret. Because her story explains why this topic deserves far more attention than it gets. If you are watching right now, type your age in the comments. And let me ask you something simple. Do you wake up with a dry mouth in the morning? Yes or no? You may be surprised by how many people deal with this every day and never mention it at all. Margaret was 71 years old. She was a retired school teacher living outside Columbus, Ohio. The kind of person who spent most of her life taking care of other people. Calm, dependable, never wanting to complain, never wanting to be a burden. So when she began waking up every morning with a mouth so dry she kept water beside the bed just to speak comfortably, she told herself it was nothing. She assumed it was age. She assumed it was normal. She assumed it would pass. But it did not pass. For more than a year, Margaret woke up that way almost every morning. And during that time, other things started happening. She began losing a little weight, not enough to alarm anyone at first, but enough that her clothes started fitting differently. Dry foods became harder to eat. Crackers, toast, chicken, rice. She found herself reaching for water constantly. Then came the chest infections. One in the spring, another in the fall, then another the next winter. Each time she was treated and sent home. Each time the immediate problem was addressed, but the deeper question was not. Why was this happening over and over again? Eventually, Margaret ended up back in the hospital with serious breathing trouble. Her daughter was terrified. And when the doctors began looking at the full picture, something important came into focus. Margaret's dry mouth had not been a random side effect to ignore. It had been part of a larger pattern. A warning sign that her mouth was no longer doing one of its most important jobs, protecting the rest of her body. This is something many people do not realize. Saliva is not just there to help you chew food. It is one of the body's natural protection systems. It helps control bacteria in the mouth. It protects the tissues of the throat. It supports swallowing. It begins the digestive process. And during sleep, it helps reduce the chance that harmful bacteria travel where they should not. When saliva drops too low, especially night after night, the mouth can become more vulnerable. The gums become more vulnerable. The teeth become more vulnerable. The throat becomes more vulnerable. And for some people, the lungs can become more vulnerable too. That is one reason dry mouth deserves attention. Here is the second reason. In adults over 50, dry mouth is very often linked to medication burden. Not one medication, several. Blood pressure medications, allergy medications, bladder medications, sleep aids, certain antidepressants, diuretics, acid reflux treatments. When several of these are taken together, the effect on the salivary glands can become much stronger. This is especially important for older adults because medication combinations become more common with age. A person may not notice the change at first. They simply start keeping more water near the bed. They wake up more uncomfortable. They avoid dry foods. They clear their throat more often. And slowly, the body begins showing signs that something is off. That is why this conversation matters. Because dry mouth is often treated like a minor comfort issue, when in reality, it can affect sleep, appetite, swallowing, oral health, and quality of life in a much bigger way than people expect. And sometimes, it points to a health issue that has not been properly reviewed yet. Now let me show you the 5 reasons dry mouth becomes more serious after 60. Number 1. Saliva is one of your body's frontline defenses. It helps control the balance of bacteria in the mouth and supports the tissues that protect your throat and digestive tract. When saliva stays low for long periods of time, the mouth becomes more exposed. That means more irritation, more inflammation, more trouble swallowing, and more opportunity for bacteria to multiply. Number 2. Medication combinations matter more than most people realize. It is not unusual for one medication to contribute to dryness, but when several medications with drying effects are taken together, the result can become much more noticeable. And many adults are never told to watch for that pattern. Number 3. Dry mouth can quietly interfere with nutrition. Many people think, I'm still eating, so I must be fine. But if chewing and swallowing become harder, people often start avoiding certain foods without even realizing it. They eat softer foods. They skip protein. They avoid vegetables that feel difficult to chew. They eat less. Over time, that can affect strength, energy, and overall health. Number 4. Dry mouth often changes the bacterial environment of the mouth. That can lead to more tooth decay, more gum problems, worse breath, and more inflammation. And inflammation in the mouth is not something to ignore, especially later in life. Number 5. Dry mouth is often not the whole story. It may be related to medication effects, but it can also be connected to mouth breathing, sleep apnea, blood sugar issues, autoimmune conditions, and dehydration patterns. That is why it deserves a closer look. Not panic, not fear, a closer look. And that brings me to the 7 warning signals I want you to pay attention to. This next section matters because these are the signs that may tell you whether your dry mouth is just occasional discomfort or something that should be discussed with a healthcare professional. Before I go through the list, let me ask one more question. How many medications are you currently taking each day? Just the number. Because if that number is 3 or more, the next story may sound very familiar. Robert was 68, a retired firefighter from Atlanta. Strong, practical, not the kind of man who liked talking about symptoms. When dry mouth started waking him up in the morning, he ignored it. Then the tooth pain started. Not mild discomfort, real pain. When his dentist examined him, she noticed something unusual. His mouth was much drier than expected, and the level of decay had progressed quickly. That was the moment someone finally started asking better questions. What medications was he taking? When had the dryness started? Was it worse at night? Was he also dealing with reflux? Did he wake up with his mouth open? Was he snoring? Did he feel tired during the day? That conversation changed everything, because in Robert's case, dry mouth was not happening in isolation. It was connected to reflux treatment, a blood pressure medication, nighttime mouth breathing, and reduced saliva protection over time. Once the full pattern was recognized, his treatment plan changed. His medications were reviewed. His oral care was adjusted. His sleep was evaluated more closely. And the issue finally began to improve. That is what I want you to understand. Sometimes the right question changes everything. And very often, the right question starts with a symptom people almost ignored. In Part 2, I'm going to give you the 7 warning signals, the practical steps to take, and the exact wording you can use when you talk to your doctor, so this issue is taken seriously. The 7 signals your dry mouth may be trying to show you. Now let's talk about the 7 signals I mentioned earlier. These are not meant to scare you. They are meant to help you pay attention to patterns that many people overlook. Because sometimes, the body speaks very quietly before it speaks loudly. Signal number 1. A strong chemical or ammonia-like smell in the morning. If your morning breath smells metallic or chemical instead of simply stale, that can sometimes be a signal related to kidney function or metabolic changes. It does not automatically mean something serious is happening, but it is worth mentioning to your doctor and asking about a basic kidney function test. Signal number 2. Thick or rope-like saliva. Some people notice that instead of normal thin saliva, their mouth produces a thick or foamy texture. This can sometimes be associated with autoimmune conditions, such as Sjogren's syndrome or other inflammatory disorders. Again, this is not something to diagnose on your own, but it is a signal that deserves medical attention. Signal number 3. Dry mouth that mainly appears at night. If your mouth feels normal during the day, but extremely dry in the morning, this can sometimes point toward mouth breathing during sleep. And mouth breathing is often associated with sleep apnea. Sleep apnea is far more common after the age of 50 than many people realize. And untreated sleep apnea can affect heart health, blood pressure, and overall energy levels. Signal number 4. Dry mouth combined with frequent nighttime urination. When those two things appear together, doctors sometimes look at blood sugar levels. Elevated blood sugar can pull water out of tissues and increase thirst and dryness. That is why a fasting glucose test, or A1C test, may be recommended in some situations. Signal number 5. Dry mouth together with dry or gritty eyes. This combination is one of the classic signals doctors look for when screening for autoimmune conditions such as Sjogren's syndrome. It is actually more common in women over 60 than most people realize. Signal number 6. Dry mouth combined with muscle cramps in the legs or feet. This pattern can sometimes be related to electrolyte imbalance. Sodium, potassium, and magnesium levels play a role in fluid balance and nerve function, and certain medications can affect those levels. Signal number 7. Dry mouth that begins shortly after starting a new medication. This is one of the most common causes. Many medications affect the nervous system signals that control saliva production. If dryness begins within a few months of starting a medication, that is something your doctor should know. Not so the medication is automatically stopped, but so the overall medication plan can be reviewed. Now let's talk about what you can actually do about this. Because the good news is that many people see significant improvement once the root cause is identified. Step 1. Do a simple morning check. Before you drink anything in the morning, take a moment to notice what your mouth feels like. Is saliva present? Does swallowing feel normal? Is there a strange taste or smell? These small observations can provide useful information for your doctor. Step 2. Review your medications. Write down every medication you take. Prescription medications, over-the-counter medications, allergy medications, sleep aids, even certain supplements. Bring that list to your doctor and ask whether any of them may contribute to dryness. Step 3. Understand that drinking large amounts of water at night is not always the solution. Dry mouth is often related to salivary gland function rather than simple dehydration. Small sips of water throughout the day may be more helpful than large amounts before bed. Step 4. Improve your sleep environment. Dry indoor air can worsen dry mouth. A cool mist humidifier can sometimes help, especially during winter months when heating systems dry the air. Step 5. Stimulate natural saliva production. Sugar-free gum, especially those containing xylitol, may help stimulate the salivary glands. Crunchy vegetables and proper chewing can also encourage saliva production during meals. Step 6. Prepare a clear conversation with your doctor. Instead of simply saying, "My mouth feels dry," you can explain the pattern. For example, "I've been waking up with persistent dry mouth that is affecting my sleep and swallowing. I would like to review whether my medications or other health factors might be contributing." Clear descriptions help doctors connect the dots more easily. Step 7. Know the situations that require faster attention. If dry mouth appears together with severe breathing problems, chest pain, sudden confusion, or high fever, medical care should be sought immediately. Those symptoms should never be ignored. Now let me return to Margaret for a moment, because her story does not end in the hospital. After several weeks of treatment and recovery, her medications were reviewed. One medication was adjusted, another was stopped. Within several weeks, the dryness in her mouth improved dramatically. Within a few months, her energy returned, her appetite improved, and she slowly regained the weight she had lost. Today, she spends several afternoons each week volunteering at a local senior center. And whenever someone mentions waking up with a dry mouth, she always says the same thing. "I thought it was nothing, and I wish someone had told me to pay attention sooner." That is exactly why I make these videos, because the small signals the body gives us are often the most important ones. And adults over 50 deserve clear explanations that connect those signals to real life. If you wake up with dry mouth in the morning, write the word "morning" in the comments. If you take 3 or more medications, write the word "medication." And if this video helped you understand something new about your health, share it with one person in your life over the age of 50. Sometimes, a simple piece of information arrives at exactly the right time. Subscribe for more videos like this. Clear explanations, real research, practical steps you can actually use. Thank you for watching. I'm Dr. Michael Carter, and I'll see you in the next video.